Hello everyone, welcome to Medico's Learning. Please like, share and subscribe my YouTube channel for more informative videos. In this video, we will be discussing about the most common and serious medical condition, hypertension. Before starting, let's get some basic insight towards what is blood pressure. The blood pressure is the pressure of the blood pushing against the walls of your arteries in your body. Normal blood pressure of an individual is 120 by 80 mm of Hg, where 120 is termed as the systolic blood pressure and 80 is the diastolic blood pressure. So, what does the systolic and diastolic blood pressure corresponds to? Systolic blood pressure measures the force the heart exerts on the walls of the arteries each time it beats, whereas diastolic blood pressure measures the force the heart exerts on the walls of the arteries between the beats. Getting to our topic, hypertension. Hypertension, also known as high blood pressure, is the blood pressure that is higher than the normal. When you have hypertension, it means the pressure against the blood vessels in your body is consistently too high. Moving further towards the classification of hypertension, it has been broadly classified into four main categories, that is, elevated blood pressure, stage 1 hypertension, stage 2 hypertension, and hypertension crisis. Hypertension crisis is a condition where a person requires to be admitted in the hospital as soon as possible and needs the supervision of doctors as well. So, what are the factors that puts an individual at a risk of developing hypertension? These includes increasing age, obesity, alcohol and tobacco consumption, increased stress levels, any family history, high level of salt consumption, some chronic conditions like kidney disease, sleep apnea, and diabetes. Talking about the types of hypertension, it has been divided into three main types, that is, primary hypertension, secondary hypertension, and white coat hypertension. Primary hypertension is also known as essential hypertension and has an idiopathic cause of origin. It is most commonly seen in adults and some adolescents, and the risk factors of them includes the same. Secondary hypertension occurs due to some underlying disease and is most commonly seen in young children and infants. Their causes varies with age. White coat hypertension is when the patient has blood pressure levels above 95th percentile in physician's office. Symptoms of hypertension includes headache which may persist for a longer time, double vision or blurred vision, heart palpitations, lightheadedness or fainting, shortness of breath, fatigue that can be experienced throughout the day, nausea and vomiting, and sometimes nosebleed that is generally seen in severe cases. So, coming to the diagnosis of hypertension, sphygmomanometer is an instrument which is used traditionally to measure the blood pressure. It uses a column of mercury. However, advancement in technology has came up with digital version which is more handy and easy to use device at home. Hypertension can be treated by administration of certain drugs that includes ACE inhibitors that relaxes your blood vessels, lowers blood pressure and prevents diabetes related kidney damage. Diuretics that eliminates extra water from body and helps to treat hypertension. Beta blockers that slows the heart rate and decreases the blood pressure. Antihypertensive drugs that lowers the blood pressure. Calcium channel blockers and vasodilators that helps in relaxing the blood vessel. Most widely used medication for treating hypertension is amlodipine, that is a calcium channel blocker. However, lifestyle changes can also help in preventing and treating hypertension. These includes weight loss, regular exercise, limiting alcohol intake, quitting smoking, get enough sleep, reduction in stress level, which can be reduced by yoga and meditation. Thank you for watching this video. Make sure to subscribe my channel and like this video. You can also follow me on Instagram. My username is wizard.doctors.